Hello, I'm John Perlin, Chief Medical Officer at HCA Healthcare. Welcome you to the season's finale of A Physician's Lens. It's a series of videocasts that are really meant for our clinical leadership and clinicians across HCA Healthcare. We have the chance to really let you learn more about HCA Healthcare, as well as express our appreciation for extraordinary service to our patients and communities. Today, we have a very special guest. It's our Chief Executive Officer, Sam Hazen. Welcome, Sam.
Thank you, John.
Great to have you here. It's obviously been a challenging year, but you are really an extraordinary individual. You grew up in Eastern Kentucky and a really modest background, and you are now leading the largest health system in the country. Tell us a little about yourself and how you got to where you are now.
Well, it's been an amazing journey. I've been with the company 38 years. I just started my 38th year, actually. I moved around a lot early on. After college, I wound up starting it with a company in Louisiana, moved to Atlanta, Las Vegas, worked at Sunrise for a number of years, then went to Louisville, Dallas, and Nashville. So a very sort of transient career inside the company. That was how you got promoted early on as you moved around for opportunities. But what's interesting about those opportunities is it really created an appreciation for every community that I had been in. And now we're in 43 different communities, and it's allowed me to have some perspective about the differences from one place to the other. But I did grow up in a little small town in Eastern Kentucky. I graduated from the University of Kentucky in 1982. I got laid off my dad's payroll, had to get on somebody else's, so I found this company and they would hire me. Early on, I had no passion for healthcare. I just needed money, and so this was a company that was willing to pay me. But what I've learned over 38 years is just how special the responsibility is of our healthcare systems and our healthcare professionals, and I've developed a significant passion for what we do and what our people do across the organization, John.
Well, and that's really come through this year. I think when the history of HCA is written, this is going to be one of the most significant moments that you've led us through. What do you think are some of the highlights of this past year as we've faced COVID together, and what would you tell our physician and other clinical leadership community?
If I were to sort of summarize the highlight, the most significant highlight, at least for me in my role today, is I think just a couple of things. One, the role we play inside of the communities we serve. HCA Healthcare is a large system in just about every community that we are in. We tend to be the number one or number two leading healthcare system, and with that comes a very special, I'll say, sacred responsibility. We have to be there at all times, and that really proved itself, I think, this past year. But I will tell you that from my position today, what I learned about our company, what I learned about myself, is a number of organizational things. And I think the organizational learnings that we're going to have and be able to use is going to benefit our patients in the long run. And we learned to collaborate better across function. I think in any big organization, you can get into silos, and we could not be in a silo in order to deal with this particular situation. And so cross-collaboration was very important. I think a can-do mindset. We're going to figure out how to do this, or we're going to figure out how to do that. No excuses. Let's close the loop is what we talked about all the time during our sessions. And I think that kind of mindset is important in healthcare, that, hey, let's figure this out. And then I would say speed. And speed was critical to our preparation and our response and the confidence that we developed over the course of the year. So making a big company small is not easy with process, with decision making, with resource allocation. So we were able to do that really well in 2020. And I think figuring out how to do that in a normal environment is going to be our management challenge. So I see those things, John, as very significant. I would add one more: partnerships. I think we learned throughout 2020, and we set it on the front end as it was one of our guiding principles, that we needed others to help us be successful here, and we could help others be successful, whether it was other health systems, the government, certain lab companies, whatever the case may be. If we work together as a system, if the country worked together as a system, we could respond to the COVID pandemic more effectively. And I think we did that, and we now see that as an important platform for us as we move forward.
Well, this notion of systemness is one that impresses me. Within that are the concepts of agility and coordination, and it's really a palpable difference. So out of the challenges of COVID come some very good things. What do you see as the sort of future direction for HCA Healthcare in an environment that still contains some degree of uncertainty?
Well, I think scale matters. I think it matters a lot. It matters with resources. It matters from a diversification standpoint, but it matters, most importantly, at least to me, is in what I call the lessons learned inside of HCA Healthcare. We always have solutions in our company, whether it's coming out of Miami or coming out of Denver or coming out of Dallas, wherever the case may be, we have solutions. Our challenge is to take those solutions, clinical solutions, organizational solutions, and push them across the organization. So scale matters. But healthcare is still local. So our model is built around having a local system and creating scale within it, and then marrying up that local scale with national scale. And I think the opportunity for HCA Healthcare is to bring that together even more. And for our physicians, I see real opportunity with that. They can participate in research. They can participate in training. They can participate in best practices. There's a host of things that our physicians can attach their individual practice to in a way that I would think can benefit them as well as our organization and ultimately our patients. And so I'm excited about continuing on that journey because I don't think we ever get to the end.
Well, scale is so important, and operating at two levels, the level of using the aggregate to accelerate learning, and then the ability to apply that locally, as well as kind of discover local innovation and bring that up to a national enterprise level activity. We see that in our research. In 2020, hard to believe, we took care of 120,000 COVID positive inpatients. We're still on a pretty good clip this year. I think you know that we started the CHARGE Research Consortium with academia, a lot of really prominent institutions, Harvard, Columbia, Duke, and right here in Nashville, Meharry. And we have pretty formidable research within HCA, but we are able to accelerate with these partners and with the Agency for Healthcare Research and Quality. And you've really seen these sorts of activities as part of HCA's social responsibility. You actually liberated ventilators that we had to help support the country in time of crisis. Tell us a little about what it means in terms of social responsibility to have this role that also exists at the scaled level and the local level.
So as I said a minute ago, John, I think our systems have a special responsibility locally. And HCA Healthcare, because of its size, its scale, has opportunities nationally. You mentioned the ventilator response network that we were a leader on in developing for the White House Task Force. And that was one example, I think, of how HCA can lead at a national level. You mentioned research also. We have this incredible data set that allows us to amalgamate a huge amount of data, but if we merge it with others, then all of a sudden it's producing national solutions. So that continues to be something we're pushing the organization to accomplish. But I think any large corporation in today's society in particular, whether it's diversity initiatives, whether it's community impact, whether it's education, and we're the largest educator of healthcare professionals in the country with our graduate medical education program, nursing education, leadership development, huge healthcare leadership and education programs. I think it's important that we recognize that, and I think HCA makes a tremendously positive impact in the communities we serve, and really broadly even outside of that with other initiatives. So we will continue to challenge ourselves. We see that as a very important stakeholder responsibility, is being responsible as a corporation, being engaged in the communities and creating a positive impact. But ultimately, the most significant community responsibility we have is high quality healthcare. And if we're doing that, we're accomplishing our true north. But there are a lot of other spin-off opportunities that come from that, and that's what we're trying to capitalize on as well.
Well, let's talk about the physician leadership. You've really been a champion for that. This past year, we kicked off the Medical Executive Committee and Chief of Staff Leadership Academy. That was really something you felt very strongly about. We got rudely interrupted by COVID, but in fact, that request of our medical staff to hear more about the inner workings of HCA is what led to this. How would you like to see physicians, both at staff level and those who are serving in physician governance, lean in? How can they get involved? What's the best way to engage with us?
So I was thinking when I was driving in this morning about where we are today with physician leadership and where we were 10 years ago when you first started with the company. Maybe it was a little longer than that. I don't even remember how long it's been.
14 years.
14 years, wow. I think today, with where we are, we have physician leaders across many dimensions of our business. We have them in our facilities with chief medical officers. We have them in our division. We have specialized talent at the corporate office. We have physician capability. And then we have our medical staff leadership, which is part of our organization, whether it's a medical director role, a president of a medical executive committee, leading a section of the medical staff hierarchy. All of these elements are important to our success. And they're important to our individual facility success, and they're important, I think, to the company's success. So physician leadership and integrating that into the organization, whether it's through an employment of a leader or actually just through a relationship because of the medical staff, allows us to create voice, which is critically important to our ability to deliver the care we want. Our physicians need to have a voice inside what we do, and those are avenues for voice. But what we've learned is that leadership support, cross-collaboration across the organization, again, trying to make the company small for our physicians so they benefit from the bigness that is HCA, is something that our leadership agenda for physician development is pursuing. And I believe that that's one of the reasons our physician engagement as an organization has grown. We've created an approach that our physicians appreciate, and we learned it from them. We asked them, what do you want? Well, I want voice. I want efficiency for my patients and for me. I want technology. I want subspecialty support. And I want growth. And if we can give them those elements, and that's the core of how we think about our relationships with our physicians, then we can improve their engagement with our hospitals and our facilities. And I believe we've gotten better at that over the past few years, but there are opportunities for us to get even more. And that's where the leadership of our medical staff, the leadership of our institutions can give us the input that we need so that we can improve ourselves.
Well, that's a great message, the voice, the efficiency, the growth opportunities. And as you know, I have a pretty good test audience. My wife is a frontline physician, and she feels very much a member of that local medical community, but also pretty special to be part of something larger. So in celebration of this year's Physicians Week, National Doctors Day, and to all of our clinicians who've really been at the front lines through COVID, who've endured both professional and personal hardship, I know that we are pretty grateful, but I'm sure they'd love to hear your message.
I've thanked our employees, and this is an opportunity to thank our physicians. Our physicians are as much a part of our organization, obviously, as our employees are. And I say this often, John, we are not here for physicians. We are here because of physicians. And I think for us, we could not have accomplished what we accomplished in 2020 without the steadfast commitment of our physicians and their effort to do what they needed to do for our communities, for our patients, for each other. And it's been an incredible year, and one that I'm constantly commenting on the 50,000 physicians that we have who are part of HCA, how significantly important they are to our delivery, our mission, our success. So thank you very much for giving me the opportunity to thank them for what they do day in and day out.
Well, thanks for those great words, Sam. And really, as representative of all those physicians, we thank you. There have been some pretty long days. While there's virtualized, I think the senior team under your leadership was here every day, some long hours learning the science. And you said some pretty remarkable things about making sure that this system is here to support those physicians, other clinicians, so that we can be there in the communities we serve and for each and every patient. So I join you in that thanks to all of our clinical community and our physicians, and thank you for joining us on this year's final episode of A Physician's Lens.
Thank you, John.
Thanks.